The next segment was taped during the COVID-19 stay-at-home order. My next guest, Jenna, says in 2016 she started having heavy rectal bleeding and cramps. Jenna was only 30 years old and 7 months pregnant at the time. After her son was born, she says she wasn't prepared for the doctor's diagnosis. Jenna is joining me via Zoom along with my dear friend, Dr. Freda Lewis-Hall, Senior Medical Advisor for Pfizer. Thank you both for being here. Jenna, let me start with you. What was it that the doctors discovered?
Hi, Dr. Phil.
Hi, how are you?
I'm doing well, thank you. Well, after my colonoscopy, a biopsy, and several scans, it was revealed that I, in fact, did have stage 4 metastatic colon cancer, which means that by the time it was discovered, it had already spread to other organs in my body.
Oh, wow. And Jenna, you're fighting cancer, and you and your husband, Derek, are raising a young son. So tell us about those challenges.
Of course. So Cameron just turned 4 and he's very active and loves to play, not to mention he's a mama's boy. So the guilt and heartbreak of not always having the energy or physical strength to be the mom that I wanted to be um, felt insurmountable on top of everything else I had going on. But Derek is the most amazing husband and father, and he always steps in to fill in the gap.
Well, that's great that he does. So, Dr. Freda, how many people are affected by this type of cancer?
Well, Dr. Phil, over 1 million people are living with colorectal cancer. It's the third most common cancer in the United States in both men and women. And more than 50,000 people died due to colorectal cancer last year.
Wow. So, the screening guidelines for colorectal cancer have changed, right? So, tell us about that.
Yes, they have. The American Cancer Society now recommends starting colorectal cancer screening at age 45 instead of age 50. And this is because of the rising incidence of colorectal cancer in younger people like Jenna.
Jenna, it's been 3 years since your diagnosis. So, tell us, how are you doing now, 3 years in?
Well, Dr. Phil, I have undergone years of very strong chemotherapy, along with a handful of surgeries to remove a foot of my colon, multiple parts of my liver, tumors on my lung, and my entire gallbladder. But for about 9 months now, I have been stable. So I'm doing very well, only having to have targeted therapy, and I take chemotherapy pills almost daily.
Dr. Frieda, tell us some more about this. So, how does colorectal cancer start?
So, colorectal cancer is caused by abnormal cell growth in the large intestine or the rectum. Now, these growths are called polyps, and some polyps can, over time, change into cancer.
Dr. Frieda, what increases a person's chances of getting colorectal cancer? You explained what it was and how it started. What increases the chances of someone getting it?
Well, there are a number of risk factors. They include age, family history, having an inflammatory bowel disease, or an inherited cancer gene. And there are also some lifestyle factors that can increase your risk, like tobacco use, a diet that's not rich in fruits and vegetables, or not getting enough activity or exercise.
Well, that's good to know that there are things they can do lifestyle wise. So, what do people need to know about this type of cancer?
Now, it can cause a bellyache, weakness and fatigue, unintended weight loss, blood in the stool, or changes in bowel habits. But symptoms aren't always obvious. So talk to your doctor so together you can make an informed decision about whether to get screened. And lastly, knowing if you have a particular gene mutation and undergoing biomarker testing can help inform your prognosis.
Well, many may be put off by colorectal cancer screening, but however, screening is really a small inconvenience that can literally save your life, right? So to learn more about colorectal cancer, be sure to check out gethealthystayhealthy.com, which is a great website, as I've said many times. So this can be really a life-saving education for people to check this out.